increases in the amount of money that we're spending and increases in demand, the original £70 million permission will not be sufficient to get us through to the end of the framework life cycle. Hence why we're asking for that refreshed spend permission. The framework itself fulfills a key function for the County Council in that day services are not currently regulated by the Care Quality Commission in England. So whilst we may expect to see some quite intensive care activity, personal care, people with quite complex needs attending these services, there is no external regulation in the same way that there is for care homes. So the framework, the HDOM framework itself, provides a service specification and a quality assurance mechanism for these providers. So the council steps into that space essentially in terms of making sure these providers know exactly what they're meant to be providing. We currently have 41 providers who are operating under the framework, and they're delivering services to around 850 individuals at a cost of around £9.7 million per year. The services that we commission through the framework support the council to meet its obligations under the Care Act in terms of meeting those identified care outcomes for people through assessment. HDOM is open to new applications all the time, so it's not a closed framework. Providers can come onto the framework, so there's no restriction on that. If a new provider came into Hampshire, they can apply to join. They go through a number of quality controls, and we also establish transparent pricing. So in that sense, the framework gives us a really good basis for making sure these services are commissioned properly with really clear quality assurance measures, which benefits the County Council, but also the people who use the services and their carers. And I think what I would say is day services continue to fulfill a really key respite function, particularly for people who live at home with their families, be that older carers or carers who need to go out to work. So we've seen that the day service market really recovered very strongly since COVID. We actually have more people attending day services now than at any other time in the past. In terms of consultation, the specification for the framework was developed in partnership with the provider market. We have been doing quality assurance using the service specification and giving providers feedback around how we feel they're performing against that framework. And we've also completed an equality impact assessment, which clearly indicated positive impacts for people who use services from this framework being in place. In short, we would certainly be recommending that the 4-year extension is activated. We would be looking to undertake a strategic review in that period to determine what we do beyond 2028. And our view is that the refreshed spending permission up to £50 million will be sufficient to cover all the activity planned in that period.
Right. Thank you, Jason. Jess, do you want to add anything?
Thanks, Councillor Fairhurst. I would just want to reiterate that vital function around quality assurance, given that day services aren't regulated in the same way as care homes. I think that's really important, and also the function that Jason mentioned with regard to the vital function of day services for carers. Just to say as well that there was a meeting with opposition members early in the week. Actually, I think it was the end of last week, and they had no issues with the paper and happy to support it. Thank you very much.
Super, thank you. Councillor Oppenheimer, do you have any questions?
No, nothing from me. Thanks, Liz.
No, thank you. Jason, can I just ask you, apart from the paper, which I'm more than happy to approve in a minute, there's a bit in the paper where you say that they tend to be, the service user tends to stick to what they know. How are they what do we put in place to ensure that they're going to the right place for them when they start attending, as opposed to something their carer decides because it's up the road or it's easy? You know, if they really like, say, farming or that, and they end up working in a cafe or going to a cafe, I mean, what do we put in place to ensure they get into the right sort of place so it becomes a good experience for them?
Yeah, so there's a really, really wide variety of services captured under this day opportunities heading, Councillor Fairhurst. So everything from what we might recognise as a traditional daycare centre, right down to kind of very vocationally focused, work experience type cafes, single person services doing woodwork and all sorts of things in between, very complex services as well within that mix. So the duty in terms of identifying the right service would generally fall to social workers or caseworkers who are working with that individual to work out what it is they need, where are their interests, what's local, what's cost effective for the council as well. So there's a few things that would be taken into consideration. I think generally we are quite good at ensuring the voice of the person is heard. We will consider the views of stakeholders, including parents and others, but we're very, very keen to make sure that the person's view comes, through very clearly in that assessment process. So we're quite confident in that regard.
Good, thank you. I don't think there's much more to say. I think it's really valuable. I think having visited quite a few of them, people really enjoy their time, their day out. I mean, I know it's not technically a day out, but for them it is, and they do enjoy going. So happy to approve. So if we go to the recommendation, that the executive member for adult social care and public health gives approval to extend the Hampshire Disability Day opportunity model for the next 4 years, and this would be from the 1st of December this year to the 30th of November next year, and that the executive member for adult social care and public health gives approval for the estimated maximum indicative spend in the next 4-year period of 50 million, in addition to the original approval for the lifetime of the contract. Okay.
Yeah, sorry, Councillor Fairhurst, just to be really clear, the extension option would take us through to 2028 rather than next year.
Sorry, yes, it starts next, 2028. Yeah. Okay. Happy to approve. Thank you, Jason.
Thanks very much. I'll leave now. Thank you.
Thank you. My next job is to make 3 appointments to Southern Health. The Board of Southern Health, I'd like to appoint Councillor David Harrison. To University Hospital Southampton, Councillor Louise Parker-Jones. And to Hampshire Hospitals Older Persons, ex-councillor Andrew Gibson, who I think he's now an alderman. So do we call him Alderman Andrew Gibson, or just, yeah, okay, thanks very much. Now I'm going to hand over to Councillor Oppenheimer, who's going to do some work with public health or make some recommendations for public health. Councillor Oppenheimer.
Thank you, Councillor Fairhurst. So yes, we've come to item 4 on the agenda, smoke-free generation grants. And Simon, do you want to introduce this item before handing over to your team?
Many thanks, Councillor Oppenheimer and Councillor Fairhurst. Yes, so this is a paper to set out a decision to spend around tobacco control and smoking cessation. This is part of our public health duties, and as part of we were given an additional grant to spend on smoking cessation and tobacco control work, focused on smoking cessation here, and we want to make a recommendation about how we spend some of that money with our groups of organisations that will be able to reach smokers to enable them to quit. Mohammed, I'll hand over to you for a little bit more detail.
Thank you, Simon. So the main purpose of this 3.5-year grants programme is to, as Simon said, drive referrals into our locally commissioned stop smoking services, and we will track, monitor and evaluate those referrals and the cessation outcomes for them. The total value of this grants programme will be up to £50,000 to each district and borough council in Hampshire, which is a total of 550 for district and boroughs, and up to £300,000 for voluntary community and social enterprise organisations over the 3.5 years. The reason we want to drive referrals into our service from these organisations is because quitting smoking with our service is 5 times more effective than quitting on one's own. We expect the grants to focus on initiatives such as training the paid and voluntary workforce to have effective and non-judgmental conversations about smoking cessation with our residents, which result in a good quality referral. And we will ensure that all grants will have detailed project proposals, costs, and are sustainable in nature, such that the positive impact of the grants can extend beyond the lifetime of the programme. We will also ensure that the grants will be delivered via grant agreements following the due process of the County Council. So that's a summary of the paper, and I'd be happy to answer any questions. Thank you.
Thank you, Mohammed, and thank you, Simon. So yeah, I mean, we all know that smoking is extremely bad for your health, and that if you can get people to stop smoking, they get benefits immediately, as well as reducing their risk of serious disease. They'll start to feel healthier, and so I'm glad that we've got this funding to distribute. But before coming to my decision, let's just see if anyone else would like to comment. Councillor Fairhurst, would you like to say anything about this paper?
No, I as you're probably aware, I'm very much in favour of this, and it's very interesting to hear. Is it Wes Streeting the other day on television saying that he's declared war on smoking and vaping? And I thought, well, actually, if we've been working on this for quite some time, but at least if he's behind us, we'll be able to carry on.
Yeah. Well, you know,
sorry.
Carry on, Simon. Yeah.
I was going to respond to that, Liz. Absolutely. I think what we have seen is the tobacco industry is very clever and amends its model. So actually being open and saying, actually, we need to almost stand against it is helpful for us as well. You're absolutely right. We've been doing that work, but to have everyone joined up is really useful.
Yeah.
Yeah, I mean, credit to the government for continuing with the former Prime Minister Rishi Sunak's smoke-free generation policy. You know, I'm 100% behind it. All I would like to say is that I'm pleased that the County Council will continue to have a role in spreading best practice and driving innovation. I think that's really important. You know, we want to see the districts and boroughs and our voluntary sector partners trying things. Let's see if we can reach those hard to reach people who are, you know, perhaps reluctant to quit. But if we have those difficult conversations and then get them onto a good programme, I think we can do it. Has anyone else got anything to comment? Okay, well, in that case, I'll turn to the recommendations that are on page 23. And I'm happy to approve the funding set out in paragraph 2 and the delegated authority to the Director of Public Health set out in paragraph 3. So please note that in the minutes. And I think having completed that, I'll hand back to you, Councillor Fairhurst, to close the meeting.
Thank you, Councillor Oppenheimer. Right, Marie, would you like to stop the recording?